you've got a client with a hip problem, you're probably interested in how much force they can recreate with hip abduction. But the question is, what position is best? Hi, Jacob here, owner of Peak Force Systems, here to talk to you through positioning for hip abduction. Now, one of the things I've never understood looking through hundreds of research articles on people that use handheld dynamometers for strength testing is why there is such extreme variability in position setups. Namely, what frustrates me most is we see all of the time people will set up a hip abduction strength test inside lying. Now, certainly when we're all in school, we're trained to test inside lying, but that's all kind of a remnant of the scale of MMT and anchoring it against gravity, right? So we know a 3+ out of 5 means that we can resist, we can do a full arc of motion against gravity. So we need to be inside lying to orient ourselves to the vector of gravity. However, if you've done this, try to do an MMT test in a real life client, then you quickly realize that there are lots and lots of variables, and it can be tricky to get a patient set up in a true side lying position and make sure that we're testing what we want to test. There's all sorts of pelvic rotation that can happen. It can be tough to get the leg lined up. There's just lots of noise in trying to set up that test position well. So I've never understood why we just blindly adopt that test position when we don't really care about gravity anymore, when we're testing with a device that can measure the amount of force. Certainly, we are big advocates of setting up in supine. Supine with one leg bent, so kind of half hook lying, if you will, and your leg hanging off the edge of the table. Looks like this here. We feel like this is a much more repeatable, much more stabilized test. And then also, you don't have nearly as much compensation from the contralateral limb, which is assisting you. Certainly, you require some stability from your contralateral side to stabilize your pelvis with any sort of hip abduction test. But we feel that this position here gives us our best setup. So, in summary, if you're going to do side lying abduction, sure, I guess. I don't necessarily have a hard time finding a reason why you would want to set it up that way. But if you have a specific reason, great, I'm for it. Here at Peak Force, we certainly recommend a supine half hook lying position and find that it's a little bit more reliable and gives us more useful data. Thanks for watching. Definitely check out our Instagram at Peak Force Systems and our website at peakforcesystems.com for more educational content.